landscape for insurance coverage for residential treatment is on the verge of some great changes. What has happened in November of 2013, the federal government issued regulations which specifically require that certain intermediate levels of mental health treatment be included in the Mental Health Parity Act. All of these changes went into effect for plans that had renewal dates on or after July 1st, 2014. So this means that residential treatment is now or will soon be a covered benefit for most families. Of note is that the Mental Health Parity Act used to apply, the Federal Mental Health Parity Act used to apply to only those companies that had employers greater than 50 people. It now applies to all plans except those that are grandfathered and some local government plans. Wilderness therapy should be included as a residential treatment in most cases. We're hoping for this. We believe that this represents an exciting opportunity for residential treatment centers and therapeutic boarding schools to become licensed in their respective states and to get in plan networks if it's to their advantage to do so, and to offer these benefits to families who seek coverage.
Several months ago, we were contacted by the family of a 17-year-old boy we'll call Ben. Ben has Asperger's and also suffers from anxiety and depression and was abusing marijuana. His family contacted us after he had already been in residential treatment for 4 months. We applied retroactively to the family's health plan, which was Anthem, asking for coverage. Not surprisingly, we were denied. We then appealed the case to the Department of Managed Health Care and argued that under the California Mental Health Parity Act, this child was entitled to receive coverage of residential treatment. We prevailed, and just a few weeks ago received a happy call from the family. They had received a $50,000 check in the mail, and they were able to get coverage for almost 7 months of residential treatment. We also received a call not too long ago from the family of a 19-year-old boy that we will call Andrew. Andrew also has Asperger's and was having violent behaviors towards his family and his sister and suffering from extreme depression. This family also contacted us after he'd been in treatment for 4 months. This family had Blue Shield of California, which had a specific exclusion for residential treatment, so they had never thought they had any option of obtaining coverage. Turns out, under the California Mental Health Parity Act, and soon, if not already, this will be the case in all 50 states under the Federal Mental Health Parity Act, it's illegal to exclude residential treatment as a covered benefit. On this grounds, we appealed to the Department of Managed Health Care, the oversight agency in California, and prevailed. And this family also received a check recently for $48,000 in the mail, covering 6 to 7 months of treatment. We've been successful obtaining retroactive coverage of residential treatment in states that already have state mental health parity acts that specifically say you cannot exclude residential treatment. Now this is going to be the case in all 50 states, and we're excited to be able to help families across the U.S. obtain insurance coverage of residential treatment. And while we have been successful at obtaining retroactive coverage, we really encourage families and treatment centers to be proactive to maximize their chances of coverage. So in our talk, we are going to outline 4 specific steps that families and treatment centers should take in order to maximize their chance of insurance reimbursement. And we look forward to giving this talk.
That was